Hello and welcome to Pregnancy Info. Today we are going to discuss that is the sex safe during pregnancy or not safe. Sex is a healthy part of a loving relationship with your partner. It is okay for you to have sex when you are pregnant. For most women, yes, sex is safe during pregnancy. But for other women who have some complications and health problems, they may avoid it. Here are the top things you need to know about sex during pregnancy. If your pregnancy is healthy, you can have sex. You and your partner can use positions that are safe and comfortable throughout pregnancy. Sex doesn't hurt your baby. The amniotic fluid in your uterus helps protect your baby when you are having sex. If you have pregnancy complications now, or if you have had them in the past, having sex during pregnancy may not be safe. If after having sex you have heavy bleeding, painful cramps, or leaking amniotic fluid, call your provider or go to the emergency room. It's okay for you to have changing desires about sex during pregnancy. Talk to your partner about what makes you feel comfortable. The question is that when is sex not safe during pregnancy? Sex may not be safe during pregnancy if you have certain pregnancy complications now or if you have had them in the past. If you have any of these complications, talk to your provider to see if it's okay for you to have sex or not. You were pregnant with multiples, twins, triplets, or more. You had a miscarriage in the past, or you are at risk of having a miscarriage in this pregnancy. Miscarriage is when a baby dies in the womb before 20th week of pregnancy. You had a premature baby in the past, or you have signs of preterm labor in this pregnancy. A premature baby is a baby born too early, before 37 weeks of pregnancy. Preterm labor is when your labor starts early, before 37 completed weeks of pregnancy. You have an incompetent cervix. This is when the cervix opens too early during pregnancy. The cervix is the opening to the uterus that sits at the top of the vagina. An incompetent cervix can cause you to have preterm labor. You have placenta previa. This is when the placenta lies very low in the uterus and covers all or part of the cervix. Placenta previa can cause serious bleeding and other complications during pregnancy. How you can have sex during pregnancy which is safe? Sex doesn't hurt your baby during pregnancy. The muscles of the uterus and the amniotic fluid that surrounds the baby in the uterus help protect your baby. The mucus plug also help keeps your baby safe from infections. The mucus plug is a mass of mucus that blocks the opening of the cervix. If your partner is male, his penis doesn't make contact with your baby during sex. So, almost it's safe to do in the pregnancy. But you have to avoid STI or STDs. Protect yourself from sexually transmitted infections called STI or sexually transmitted diseases or STD. An STI is an infection you can get from having unprotected sex or intimate physical contact with someone who is infected. STI can cause problem for your baby during pregnancy and birth. You can get an STI from vagina, anal, or oral sex. If you have sex during pregnancy, have sex with one person only who doesn't have other sex partner. Don't have sex with a partner who may have STI. If you have a new partner, use a condom. If you have oral sex, to show your partner does not blow air into your vagina. Oral sex is sex that involves the mouth and genital organs like the penis and vagina. Blowing air into the vagina can cause an air embolism, an air bubble that blocks a blood vessel. This can cause serious problem for you and your baby. Ask your provider if it's okay to have anal sex, but according to Islam, it's prohibited to have anal sex. Other than that, it is dangerous for you and your baby because you may be more likely to get an infection with bacteria in your vagina. Bacteria are tiny organisms that live in and around your body. Some bacteria are good to your body, but others can make you sick. How can pregnancy affect your sex life? Your interest in sex and desire for sex, also called your sex drive, can change throughout pregnancy. Rising and falling hormones levels and other changes in your body may affect your sex drive. Whatever your mood is, let your partner know what feels comfortable or uncomfortable. Your partner's desire to sex may increase or decrease too. Sometimes partners may feel closer to you and sometimes they may be more anxious about your health and your baby's health. Talking to your partner openly about these issues can help. Here are some common sex drive changes you may feel during pregnancy. In first trimester, changing hormone levels early in pregnancy and changes in your body shape may make you feel sexy. But these changes also may lead to pregnancy discomforts that make you less interested in sex, like feeling tired or sick to your stomach, also called nausea, having sore breasts, and needing to go to the bathroom often. Second trimester, you may feel better during the second trimester. Discomforts may have had in the first trimester have gone away, or you may be able to manage them better in the second trimester. Your belly is growing but is still small enough to have sex comfortably. In fact, you may have to have sex more often than you did in the past. Third trimester, if you and your partner both desire it, it's okay to have sex until the birth of your baby unless your provider has told you otherwise. Toward the end of pregnancy, you may feel less interested in having sex as your belly gets bigger and you may find some sex positions to be uncomfortable. You may be less interested in sex because you are more focused on giving birth and having a new baby. It's okay to have these feelings. You and your partners can still be loving and close even if you don't want to have sex. Which sex positions are best during pregnancy? Positions that work before pregnancy and early in pregnancy may be uncomfortable or even unsafe during last stages of pregnancy. So, here are some positions for you. Women on top. This position puts you in control of how fast, slow, and comfortable you are during sex. It can also take the pressure off your belly. Spooning. Lay sidewise with your partner lying behind you. Having sex in the position helps lower the amount of pressure placed on your belly. Women on hands and knees. You may also choose to support yourself on your elbows. This position works best during the first and second trimester because it lowers the pressure placed on your belly. As your belly gets bigger, you may find this position uncomfortable. Now, we will discuss some benefits of sex during pregnancy. Sex during pregnancy can come with some pretty sweet perks. Here are a few benefits of pregnancy. Sex that just might make your time in bed even better. It's safe partner bonding experience. Pregnancy is an emotional roller coaster for both you and your partner. Being intimate with one another is a great way to stay connected to each other during the exciting time. It's great for your physical health. One 30-minute sex romp can burn around 50 calories and it lowers your blood pressure too. It can ease pain and discomfort. Since orgasm signals the release of oxytocin, a hormone that can increase your pain tolerance, they can help with those backache and other pregnancy-related pains. It improves sleep. Not only during pregnancy, sex helps you relax, but it releases the above-mentioned feel-good hormones as well. It's a mood booster. Even if you are super excited about your pregnancy, those pesky hormones can still cause anxiety and the blues. The release of oxytocin that comes with an orgasm isn't just beneficial for physical pain, it can help increase your feelings of love and joy, bringing you closer to your partner. It may help labor along when you are ready to go. Having an orgasm causes your uterus to contract unless you're nearing the tail end of your pregnancy or your baby is ready to begin the birthing process. These contractions aren't strong enough to make you go into labor, but once your baby decides that it's just about go time, a romp in the sack may be able to help move things along. It may ease your postpartum recovery. Because pregnancy sex can help your pelvic floor, you're preparing your body for both childbirth and recovery. Just by having orgasm, you can also try doing kegels during sex if you want to go those vaginal muscles in shape even more. So, these are the benefits and side effects and all about that it is safe or not during pregnancy. I've explained all in details. So if you find this video useful, then share it with your friends and the females who are pregnant. Also subscribe my channel and you can give your suggestions in the comment section. Thank you.